How do doctors actually diagnose dementia, step by step? What happens first? And how do you know it's not just normal aging? If you're asking that, you're not alone. Families tell me this every week. Here's the first thing to know: there isn't one magic test. A real dementia evaluation is a process. We put pieces together: your story, a short cognitive test, a gentle neuro exam, basic blood work, sometimes a brain, a gentle neuro exam, basic blood work, sometimes a brain MRI, and, when it fits, biomarkers. Think of it like building a clear picture from several honest snapshots, not one blurry photo. Why does that matter? Because getting this right changes everything: treatment, safety, and peace of mind. So where do we begin? Not with a machine. With a conversation, simple, human, and surprisingly powerful. Let's start there. When someone comes to me worried about their memory, I don't rush them into tests right away. Instead, I take time to listen, really listen, to their story, every small detail, every subtle feeling they've been experiencing. I ask, what was the first change you noticed? Some tell me they forgot the name of a neighbor they see every morning. Others say that, every now and then, they struggle to find the right word in conversation. These moments, small as they seem, can be early warning signs of dementia we need to catch. Listening is about understanding, not judging. Every detail you share helps me piece together the bigger picture. Is this simply normal age-related forgetfulness, or are these warning signs of dementia you can't ignore? At this stage, trust begins to build between doctor and patient. When you know you're being heard, you speak more openly, and that honesty brings us closer to finding the right answer. Before we move to brain scans or lab work, I like to start with something simple: seeing how your memory works in the rhythms of daily life. I might ask you to remember 3 unrelated words, like apple, chair, and river. Then, after a short conversation about your morning routine, I'll ask you to recall them. It's not about tricking you. It's about observing how your brain stores and retrieves small bits of information. We also talk about real situations. Have you recently gotten lost on a familiar street? Have you repeated a question to a family member without realizing it? These are signs of dementia in seniors that can quietly slip past daily awareness. When patterns appear, small lapses that repeat over weeks or months, they can reveal more than any single moment of forgetfulness. And that's when we know it's time to take the next step in the diagnostic process. Once we've explored memory, the next layer is attention, because dementia doesn't just touch what you remember, it also affects how you stay present in the moment. I might ask you to count backward from 100 by 7s, or name as many animals as you can in 1 minute. These aren't random tasks. They test how your brain organizes thoughts under gentle pressure. Sometimes, I'll add a distraction, like asking a question mid-task, to see how quickly you can return to what you were doing. For many seniors, this is where early warning signs of dementia emerge. Losing the thread often feels like the mind slipping through fingers, even when everything seemed fine a moment ago. If attention wavers consistently, it's a strong signal that the brain's control center isn't managing focus the way it used to. And that's an important clue for the steps ahead. Language is one of the most revealing windows into brain health. When dementia begins to affect this area, it often shows in subtle ways that family might mistake for just aging. I may ask you to name everyday objects, like pointing to a pen and asking, "What's this?" Or I might invite you to describe a simple picture in detail. If you pause too long, use a less specific word, that thing, instead of the exact name, or repeat yourself without realizing it. These are clues I cannot ignore. Sometimes, I'll listen for sentence structure and flow. A healthy brain organizes ideas smoothly, but with early dementia, words can get tangled, and the conversation takes unexpected detours. For seniors, these small language changes are often overlooked, but for me, they're quiet red flags. signals that the brain's language networks are struggling to keep pace. This is where we test the brain's manager. Executive function is like the conductor of an orchestra. It keeps every section in sync, making sure decisions, planning, and actions happen in the right order. I might ask you to solve a simple puzzle, such as arranging shapes to fit into a pattern, or to plan the steps for mailing a letter. It sounds easy, but for someone in the early stages of dementia, the process can feel like walking through fog. They may skip steps, get stuck on one part for too long, or lose track of the goal entirely. It's not about intelligence, it's about the brain's ability to coordinate actions without getting lost. When I see this difficulty, I know the brain's planning department is under stress. It's one of the clearest signs that daily life may soon require more support. This is where the science meets real life. We step away from paper tests and puzzles and look closely at how a person moves through their day. I'll ask about routine activities, managing finances, remembering medications, cooking a familiar meal, or navigating to the grocery store. These aren't just chores, they're the threads that hold independence together. Sometimes, the person insists they're fine. But as we speak, a family member may quietly mention missed bills, burned pots, or getting lost in a neighborhood they've known for decades. In dementia, the breakdown often begins subtly, a forgotten ingredient here, a misplaced utility bill there, until one day, it's clear that living alone has become risky. This step is about more than diagnosis. It's about protecting dignity while finding the safest, most supportive way forward. Once the patterns in memory, language, and daily life become clear, we turn to the brain itself for answers. Medical imaging, often an MRI or CT scan, allows us to see the brain structure in remarkable detail. We look for shrinkage in specific areas like the hippocampus, tiny strokes, or changes in white matter that disrupt communication between brain regions. Sometimes we go further, using PET scans or specialized imaging to detect abnormal protein buildup, amyloid or tau, that signal Alzheimer's disease long before symptoms peak. And in certain cases, we use blood or spinal fluid tests to find biomarkers, the biological fingerprints of dementia. These tools don't just confirm what we suspect. They help rule out other causes, such as tumors, bleeds, or reversible conditions that mimic dementia symptoms. By combining these images and lab results with the earlier steps, we can map exactly where and how the brain is changing, turning uncertainty into clarity, and fear into a plan. Not every case of memory loss or confusion is the start of dementia. Sometimes, the brain is simply reacting to something it can recover from. That's why this step matters so much. We search for conditions that look like dementia but can be reversed with the right treatment. We check for vitamin B12 deficiency, thyroid imbalances, infections, or side effects from medications that cloud thinking. Even sleep apnea or chronic dehydration can mimic early dementia symptoms. I've seen patients walk into my office, worried they were losing their mind, only to find out a simple change, like adjusting a medication or treating an infection, brought their memory back to life. This is the step where relief often enters the room. It's a reminder that not all forgetfulness is permanent, and that careful investigation is the key to protecting the brain. A single test score doesn't tell the whole story. The brain changes slowly, and sometimes the difference between normal aging and dementia is only visible over months or years. That's why we repeat certain cognitive tests at regular intervals, measuring memory, attention, language, and problem solving. It's like taking snapshots of a garden through the seasons. One photo might look fine, but put them side by side and you begin to see which plants are thriving and which are fading. These follow-up assessments allow us to confirm patterns, spot rapid declines, and adjust treatment or support early. They're not just about numbers, they're about understanding the pace and shape of each person's journey. For families, these results offer clarity. They show whether changes are a gentle slope or a steep drop, helping everyone prepare with compassion and practical steps. No diagnosis should ever feel like a verdict delivered in isolation. When dementia is suspected or confirmed, one of the most important steps is to bring the family, and often close friends, into the conversation. We don't do this to alarm them, but to make sure the person affected is surrounded by understanding, not confusion or frustration. Loved ones can learn how to respond to memory lapses, how to create safe routines, and how to recognize subtle changes before they become crises. Involving the support network also means giving them space to express their own fears, because dementia touches everyone in its circle. With the right guidance, families become partners in care, helping maintain dignity and connection even as challenges grow. When everyone shares the same map, the road ahead feels less lonely and far less uncertain. Every brain tells a different story, so no two care plans should look the same. Once the diagnosis is confirmed and we've gathered every piece of the puzzle, test results, symptom patterns, family observations, we begin shaping a plan that fits the person, not just the condition. This plan might include medication to slow progression, but it also covers daily structure, nutritional support, physical activity, and mental stimulation tailored to the individual's strengths. For some, it means joining a local memory cafe, for others, gentle walks in familiar neighborhoods. We also plan for emotional well-being, quiet moments that soothe, hobbies that still spark joy, and social connections that keep the heart alive. The care plan is not a rigid rulebook, it's a living document that grows and changes as needs shift over time. When care is personal, hope becomes part of the treatment. Dementia isn't a journey you walk once and finish. It's a path that changes, sometimes slowly, sometimes overnight. That's why the final step in our process is never truly final. We keep watch over the small shifts, a word that takes longer to find, a new habit that wasn't there before, or even a brighter mood on certain days. These details guide us to adjust the care plan, whether it means adding a memory exercise, changing a medication dose, or introducing more sensory activities. We also check in with caregivers, because their well-being shapes the quality of care. If they're overwhelmed, we explore respite care or community support. If they've found a new activity that lifts their loved one's spirits, we weave it into the daily routine. Ongoing monitoring isn't about chasing perfection. It's about staying in step with the person's evolving needs and holding space for their dignity, even as the road bends. In dementia care, the smallest adjustments often bring the greatest comfort.